Hello guys, you're welcome to my channel. Today I'll be discussing on anatomy of the head and an important aspect known as the TMJ. So let's discuss on the TMJ. The TMJ is a joint known as the Temporomandibular joint. That's the full meaning of the word TMJ. TMJ, Temporomandibular joint. And when we say temporomandibular joint, what is the temporomandibular joint? It's a very important joint that you see in the head. Now we are going to talk about the temporomandibular joint, and we are going to give you the subheadings to write on TMJ when you are asked to do that in the exam. Remember in my last video, I gave you a mnemonym to remember joints. So we are going to use that mnemonic to remember this joint known as TMJ. So our first thing, we start with introduction. So introduction to TMJ. The TMJ is specifically a modified type of hinge joint. It's a hinge joint of synovial variety. So it's a modified type of hinge joint. Do you know any other example of hinge joint? Perhaps elbow joint will come to mind, knee joint will come to mind. The TMJ is a modified type of hinge joint. It's of synovial variety. Next, after knowing that little introduction about the TMJ, move on to the location. Here is the location of the TMJ. The TMJ is located at what we refer to as the lateral aspect of the face, anterior to the tragus of the ear. This is the tragus of the ear. Anterior to the tragus of the ear is a joint known as the TMJ. That is a very important point to note. After this, we move on to the articular surface. What is the articular surface of these joints, the TMJ? The TMJ is formed majorly by two bones. Number one, temporal bone, and number two, the mandible. Now when talking about articular surface, we normally mention the specific part of each bone that form that joint, since not all the part of temporal bone forms the TMJ, and not all the part of mandible forms the TMJ. So which specific part forms the TMJ? It is the mandibular fossa of the temporal bone, mandibular fossa of temporal bone, and also postglenoid tubercle, postglenoid tubercle of the temporal bone. Then the head of the mandible helps in forming this joint. So two parts of the temporal bone forms this joint or participates in this joint formation, and one part of the mandible participates in this joint formation. The two parts of the temporal bone is the mandibular fossa of the temporal bone and the postglenoid tubercle of the temporal bone, whereas it is the head of the mandible that join in forming this joint. After knowing about the articular surface of the TMJ, we have to talk a little on the joint capsule. The joint capsule of the TMJ is divided into two. The fibrous joint capsule, which is external, and the synovial membrane, which lines the internal aspects of these joints. It is very important to note this. The articular surfaces of bones most times are lined by what we refer to as hyaline cartilage. For almost all bones in the body, hyaline cartilage lines the articular surface. But for TMJ, the articular surface is lined by fibrocartilage. Never forget that point. After knowing about the joint capsule, there is something that is very important to know about the TMJ, and that is the compartment of TMJ. Now let's talk about the compartment of the TMJ. The TMJ is divided into two compartments, the superior compartment and the inferior compartment. Always remember, what divides the TMJ into two compartments? It is what we refer to as the articular disc of the TMJ. So note that point. Articular disc. Articular disc of TMJ divides the TMJ into two compartments. Next, we quickly move on to the ligaments of the TMJ. The TMJ have extrinsic and intrinsic ligaments. The extrinsic ligament of the TMJ includes what we refer to as the sphenomandibular ligament and the stylomandibular ligament. Spheno. So the spheno and the stylomandibular ligaments are the extrinsic ligaments. From the word spheno, from sphenoid bone to the mandible. From the word stylo, from styloid process to the mandible. The intrinsic ligament of the TMJ is what we refer to as the lateral ligament of TMJ. The lateral ligaments. So when asked in the exam, list the ligament of TMJ, sphenomandibular ligaments, stylomandibular ligaments, and lateral ligament of the TMJ. Note these points. The stylomandibular ligament, stylo, is formed by thickening of the parotid sheets. And remember, the parotid sheet is formed from investing layer of deep cervical fascia. Remember that point, I will repeat. The stylomandibular ligament is formed by thickening of parotid fascia. And parotid fascia is formed by the investing layer of deep cervical fascia. Lateral ligament of TMJ is formed by thickening of the joint capsule. So this is a possible question. Which ligament of the TMJ is formed by thickening of joint capsule? Lateral ligament of TMJ. And which ligament is formed by thickening of the parotid sheets? Stylomandibular ligaments. It is very necessary to know this, that the lateral ligament of the TMJ helps to prevent lateral dislocation of the TMJ. The postglenoid tubercle helps to prevent posterior dislocation of the TMJ. Therefore, the TMJ is most likely to be dislocated anteriorly. So if you see in MCQ, the most common position of dislocation of TMJ is posterior. That's wrong. It is prone to what? To dislocation anteriorly. After knowing the ligament of the TMJ, we move on to what we refer to as the movement of the TMJ. The movement of the TMJ includes depression, elevation, protrusion to go forward, and retrusion to go backward. Protrusion, retrusion, elevation, depression. These are the movement of TMJ. After knowing about the movement, you go to the muscles that brings about this movement. The muscles that bring about this movement, it's very important to know them. They are generally the muscles which we include as the muscle of mastication and the suprahyoid and infrahyoid muscles. Alright? Then specifically the muscles that are responsible for protrusion, retrusion, elevation, and depression. Perhaps that would be one of your questions in the upcoming exam. So after talking about the muscles of TMJ, we move on to what we refer to as the innervation. And remember Hilton's law. Hilton's law states that it is the same nerve that supplies the muscle that crosses a joint that will supply that joint. So the nerve supplied to the joint is same as the nerve supplied to the muscle that crosses that joint. So any muscle that crosses a joint, the nerve that supplies that muscle, we also supply the joint. The nerves that are related to the TMJ is majorly auriculotemporal nerve. So it's one of the nerves that innervates the joints. Then facial nerve is also related to the joints and also innervates it. Dislocation of the TMJ therefore can lead to injury or damage to which of the following nerve? Auriculotemporal and facial. Always remember that point. After innervation, we quickly go to the applied of TMJ. One of the applied of TMJ is dislocation of the TMJ, which should be mentioned here as dislocation. I said it can majorly affect what? Can majorly affect which nerve? Auriculotemporal nerve and facial nerve. This is just a brief video of TMJ. TMJ and how you can arrange it in exam conditions. Thank you very much. Please subscribe to my channel as videos will be flowing in almost every single day. Thank you very much.